Journal of the International Federation on Aging. I'm delighted to be the moderator for this first 2017 IFA WHO webinar series entitled Establishing Age-Friendly Environments. I'm also very pleased that I'm going to be introducing a great colleague and a great friend in Miss Alana Officer, who's the main presenter for this, our first webinar. Let me tell you a little bit about Alana. Alana is highly qualified and credentialed professional. She has lived and worked in many regions of the world, and she's been responsible for landmark resources in the field of disability. She developed such landmark resources as the WHO Global Disability Action Plan of 2014-2021. In 2014, Alana led the development of the first evidence-based world report on ageing and health, which was published in 2015. And this supports the development of the Global Strategy and Action Plan on Ageing and Health. You know, I've known Alana for a few years now, and what I've come to understand Alana for is her commitment, but also her insightfulness to listen, to consult, and then work with others to create and recreate agendas. And at the present time, she has the tremendous responsibility with others in overseeing the work of age-friendly environments. And this is the topic of today. But I also have to say that she is the mother of a 3-year-old called Isla. And Isla loves speedboats, and she had her first violin concert just recently. So thank you very much, Alana, for presenting at our first IFA WHO webinar.
Thank you very much, Jane. It's such a pleasure to be here, and I'm phenomenally grateful to the International Federation of Aging for the support on the webinars, but more broadly on the great work that you do on developing age-friendly environments sort of writ large. So, thanks to all of those that are on the call. It's really fabulous, I think, to be able to connect with you. And I'm really looking forward to your feedback also, as this is our first in a series and a great opportunity, I think, for us to learn from you as to whether this responds to your needs, but also how we can improve. So today what I'm going to do is I'm going to look at where we are within the global network on age-friendly cities and communities, where we've come from, where we are today, and where we're going. And in doing so, I'm really going to reflect on changes in direction and priorities that are happening at a global scale, which are really phenomenal opportunities and very influential in terms of the way that we move forward. It is not going to come as a surprise to any of you the comment that the world is changing and that we can't build our future on our past. We're all living longer, 20 years longer on average than we did 50 years ago. We know that there are many more older people. If I reflect that just in 1950 there were 40 million people aged 80 years and older in the entire world. And yet by 2050, so the middle of this century, there's going to be 120 million in China alone. 430 million in the world. And 80% of these older adults are going to be living in low and middle income countries. What's also changing is the share of the fact that older people living in urban communities. You know, from the 1990s to the middle of the next century, that's going to multiply 16 times the number of older adults living in urban communities. In 2006, you all know that WHO and my predecessors were really inspired and innovative and led what has been really formative research in 23 cities in over 20 countries around the world. And that this was key in terms of identifying what we could do to become more age-friendly. But today, there are nearly 800 cities alone in Quebec that have experience in implementing age-friendly approaches over a number of years. What else is changing? The incredible political agendas that are driving our work, whether it be the Sustainable Development Goals or the new urban agenda. And I'm proud of our organisation because WHO has responded by adopting some new directions. They've responded, or we've responded, by making ageing a priority within the organisation, which it's never been in the past. And within that, healthy ageing, the focus of this new direction. Jane mentioned the first ever World Report on Ageing and Health, which really tried to bring together the best available evidence that we could find, and it provides this new conceptual framework for healthy ageing. And I'm going to go through that a little bit because it's important for the work that the global network is going to do. So the goal of healthy ageing, or the definition of it, is it's the process of developing and maintaining the functional ability that enables well-being in older age. Now this new concept is relevant for every older adult. And in short, what functional ability means is enabling older adults to do what they have reason to value. Not what we might decide, but what older adults themselves have reason to value. And this concept importantly recognises that every older person is different. We know that some 80-year-olds may have the physical and mental capacities of a 30-year-old, while there might be others at much younger ages who require significant support in everyday activities. But what we understand also is that for all older adults, health will be absolutely crucial to how we all experience older age. And so what influences health in older age? We know that there are the individual factors, so our behaviours, age-related changes, our genetics, you know, not a lot, but significant, and whether we have any health conditions. But also the environments in which we live. How accessible our housing is, whether we have access to assistive technologies, decent health and social care, accessible transportation. And functional ability as a concept brings together the individual and the environmental aspects into one concept. So on what is the left of my screen, and hopefully is the left of yours, is that you've got this sort of pink box which brings together all of those individual characteristics. So what your personal, you know, age, sex, your genetic inheritance, but all of the other health characteristics that you might have in terms of, you know, health-related changes, diseases, injuries and things, which contribute to everything from your skin in, basically, you know, you're in what we call your intrinsic capacity. And in addition, the environment and the environment writ large, so really thinking about, you know, those policies and systems and services, whether it be transport, housing, information and communication, but also attitudes and supports from family and friends and other community members. And so what's really important in the concept of functionality is you as an individual in terms of everything, you know, in terms of your physical and mental capacities, but also the environment and how they interact. And developing functional ability requires two things. Efforts to build and maintain our physical and mental capacities across the life course and into older age, and that's the sort of showing the general trend of developments of intrinsic capacity, but also to build our functional ability, which generally, because of the fact that the environment can be supportive, or is generally can be supportive, is higher than what our own capacity can help us do. And so the really exciting thing I think about the new framework in the report is that then it looks at the fact that people may have different needs, whether they have really high and stable capacity, declining capacity, or really significant loss. There are things that we can do to enhance people's intrinsic capacity at all of those phases across the life course, as well as being able to do things to enhance their functional ability. For example, creating an environment are absolutely key to both developing and maintaining intrinsic capacity and ability. For example, creating walkable environments are very positive to enhancing intrinsic capacity, whereas somebody who has limited mobility may benefit from an assistive technology to enhance their overall functional ability. And when we started to look at the evidence around what is important to older adults, we identified that there were 5 abilities that were particularly important. And these are really going to be important also for the work on age-friendly cities and communities and beyond. And those are to meet the basic needs of older adults for financial security, for housing, and for safety. Continue to create opportunities for older adults to learn, grow and make decisions. For older adults to be mobile, to get where they want to get, when they want to get there. To build and maintain their relationships and to contribute in whatever form they may choose. And that if we do it right, and that means that having older people at the centre of all of our actions, that they can enable, that these investments can enable older people to age safely in a place that's right for them, be free from poverty, continue to develop personally, contribute to their communities, while all the time retaining autonomy and dignity. And it's going to be very important as we go forward to measure what impact that we're having on ensuring that older adults can do what they value, and that also that we are building their abilities and their functional ability to continue to do what they value, irrespective of changes in their physical and mental capacity. But to be able to achieve this, and this was, I guess in the original WHO guide on age-friendly cities, was really towards the end, but is so important, is this importance of working effectively across sectors and at different levels of government and with broad stakeholders in trying to enable and create or enhance people's abilities. If I just take an example of mobility, which is a simple one, and we want to take Mary, who's at point A, and she wants to get to a vegetable shop at point B. And so we need, for mobility, accessible housing. We need to make sure that buses or taxis or other forms of transportation are accessible, that she has access to assistive technologies or other personal assistance services, that there's a pleasing and safe neighbourhood, that footpaths, pedestrian crossings are available for her to get from A to B, that any benches to rest on or public toilets are available, and that when she finally gets to the shop, that the shopkeeper is helpful and friendly. And for those of you who are very familiar with the 8 domains as originally proposed by WHO, you can see that the approach and the focus, which is really complementary on enhancing the abilities of older adults, actually bring together these various different domains effectively. And the aim here is to really try and get sectors working more effectively together for the outcomes that are important for older adults. Another key development and an important direction for us is also that for the first time ever in the history of WHO, there's really broad political support for age-friendly environments. In May of last year, the World Health Assembly, and Jane alluded to this, and so the World Health Assembly is the governing body of the World Health Organization, and it brings together 194 countries that are members of our organization. And they came together in May last year, and they adopted a global strategy and action plan on aging and health, which spans the 15 years of the Sustainable Development Goals. Age-friendly environments was determined as one of the 5 priorities for the strategy, and the Global Network on Age-Friendly Cities and Communities is the key mechanism for enabling multi-sectoral collaboration. In July, so not long after, the G7 countries met, and they put aging and health for the first time on the G7 agenda, but specifically highlighted the need for age-friendly communities. So you may rightfully ask, where are we and where are we going, and how are we going to take advantage of what is really an unprecedented opportunity? So for those who are not familiar with the Global Network on Age-Friendly Cities and Communities, the vision of the network is that every city and community strives to become more age-friendly. The mission of the network is to really enable cities and communities around the world to make progress on that journey by inspiring change, by showing what can be done and how it can be done, by connecting cities and communities worldwide to facilitate the exchange of information and experience, and by supporting cities and communities to find appropriate, innovative and evidence-based solutions. So the network was established in 2010, and now, as of today, there are 400 cities in 37 countries, and in reality, those numbers of cities and communities who have joined the network have doubled in the last 18 months. We work with 11 affiliate organisations, which are government and non-government organisations, which are really key to being able to provide and to support many of those functions of the network. We have an information platform called Age Friendly World that has a huge number of resources, age-friendly practices and information on individual cities and communities and their work. So where to from now? For us to really ensure that the global network is fit for purpose, can capitalize on the opportunity and respond to the needs of its members, we want to work on strengthening our relationship with our existing affiliates, and by that we're developing agreements in terms of reference on what those relationships will be. We're looking to expand our strategic partners and link much more effectively with other transnational networks, as well as research institutions, so that we can really enhance our capacity to understand what works and what doesn't work in the implementation of age-friendly cities and communities. We're looking at reviewing the membership criteria and the governance mechanisms, and this is important to ensure that we take into consideration also the demand from the Global Strategy and Action Plan is to involve different levels of government and to really enhance the multi-sectoral approach. We need to upgrade and expand the platform for information sharing. We want to create opportunities where we can catalyze innovations. So really trying to understand what are some of the challenges in cities and communities and bring diverse stakeholders together to find innovative ways that may be useful in tackling those challenges. We want to gain the incredible, or draw together the incredible experience that exists in the cities and communities that are part of the network and beyond, to enhance the evidence-based guidance that we give, to provide a range of age-friendly practices which can inspire action in cities and communities around the world. We believe that there's an incredible opportunity also to draw on the network to be able to share their experience of what works through training programs, through mentoring opportunities, and for more diverse opportunities for networking and exchange. The times are changing. WHO has responded with a new framework for action. There is incredible political will at a level that is rare, I think, generally on a topic, but really needs to be harnessed. Creating age-friendly environments is one of the 5 objectives and priorities for the work that we're going to do on ageing and health generally. The Global Network for Age-Friendly Cities and Communities is really a priority in that work on age-friendly environments. And now it feels like, is really the time that we need to take advantage of the fact that so many stars are aligned and an incredible opportunity exists. Thank you very much.
Thank you very much, Alana. Look, first of all, I think that we should congratulate Alana for attracting the attention of 183 people to this webinar. So that's a pretty good start. And you've also provided an opportunity for a lot of time for questions. So I'll kick it off. And this is one question that's often asked of me. Who's doing the best? How can I learn from that country or that project? And it comes back to the importance of, a network model, but also the importance of the global network. So, can you just share a few examples of who's doing what well in the world?
Yeah, with pleasure. I think, I got this question last week also when I was in the UK. My response then is going to be similar to my response today in that sense, is that one of the things that I'm seeing within the global network is that no city has it, or community has it right in all aspects, yeah? And why would we expect it? This is a relatively, young movement in that sense. But there are pockets of brilliance, yeah? There are examples all over the world of very concrete practices, which is what we're trying to harness in terms of the collection of age-friendly practices, of really interesting and innovative examples in a range of areas. I think in terms of good practice, I think there's some really, incredible opportunities from anything from Brussels, which is currently running, they're reconnecting people within their neighbourhood. So working with older adults and people with disabilities who have specific needs, maybe for help with the lawn, assistance with shopping, some basic support activities, and connecting people living in the same community who have the time and interest to be able to provide some more community support. So creating those linkages between people, those sort of physical linkages that in some places are breaking down. So that's a really interesting example of harnessing and connecting people who are in need and people who want to provide support.
Okay, look, thank you. And look, we've got some questions coming in now, and I'd like to encourage people on the call to type their question in, because we can see them, and then we can put Alana on the spot a little bit. So, Alana, one of the questions that's come through is, how do age-friendly environments as a concept address urban design, including air, soil, and water quality?
Great question. So, age-friendly environments, urban design, and air quality. I'm wondering, can I see the question?
Air, soil, yeah. Air, soil, and water quality.
Yeah. I mean, age-friendly environments, writ large, cover all of the policy systems and services, whether that be on obviously, which have huge impact, you know, on urban development, on urban planning, on transport, on housing, on zoning. So these are all of the, on transportation. And so all of these factors have a huge impact, obviously, on air, soil, and water quality. So, and in terms of the age-friendly approach, looking at what are the needs of older adults, but also the needs of other people, of, you know, across the life course, and ensuring that decisions that are being taken around investments that could be made in those various different sectors, you know, take into consideration the impact that they're going to have both on the intrinsic capacity, obviously with physical and mental capacities, which are heavily affected by air and water pollution, for example, as well as, you know, how they can enhance people's ability, i.e. what they can do even when they experience declines as a result of air or water pollution, for example.
Just sort of technically inept sometimes when it comes to these things, but we've got a number of more questions. How can we promote housing options in a community that is majority single detached residential homes?
How can we promote, sorry, you just cut out there, so how can we promote housing
options, so different forms of housing as we get older in a community where the majority is single detached residential homes, which is actually quite limiting to the kind of model around functional ability.
Yeah. Well, I think we've got some really interesting examples. You know, I think that, for example, in here in Geneva, there is examples where single detached houses and older adults living in those, but who are requiring who want to stay at home, but who require other forms of support which are difficult to provide within their home environment. There is, for example, a program here which is linking university students to older adults who are living in single detached housing, making the connection between the fact that, you know, the costs in Geneva are prohibitive in terms of accommodation for students, and that those students therefore provide some personal assistance to the older adult, doing the shopping, mowing the lawn, cleaning the windows, having a meal with them. So providing some of their needs that they have within those environments. There are obviously other really interesting examples, I think, in the Netherlands and Finland also, of trying to look at using more effectively, because it's, you know, there are often other housing options within those contexts, and using those more effectively, whether it be around, you know, co-housing in terms of retirement housing, but also making that co-housing. Yeah, I mean, I think, you know, in terms of the housing options for single detached, I mean, obviously making sure that those houses are as supportive of people as they age and can adapt according to those needs are really important. Making sure that we've got outreach, you know, support services, and looking at smart technologies and others which can enable people to continue to live well within those environments are important.
In some ways, they're actually, you know, saying that we've actually got to, you know, look around in the environment to actually support, you know, the restriction of a housing option. Look, let me go on to another question, and this is from Andre. Has the WHO considered any mix of the global network of age-friendly cities and communities with the idea of smart cities? And, you know, you and I have often talked about, we've got healthy cities, smart cities, and age-friendly cities and communities. So I'm sure there's been some discussion, you know. So could you comment on that?
Yeah. Thanks, Andre. Really interesting question and very timely in that sense. So what we're doing at the moment is we're doing a broad analysis of all transnational networks, so smart cities, resilient cities, healthy cities. So really looking broadly at the various different city networks, of which there are over 200 at the moment operating around the world, and looking at where there could be synergies, whereby we could engage strategically with them because we could add in an aging lens which as a network would enable, for example, smart cities or healthy cities to do what they do better by better considering and thinking around the needs across the life course and specifically with older adults, and at the same time being able to draw from those networks also to the benefit of the cities and communities within the global network of age-friendly cities and communities. So strategically, I think that this is a really important opportunity and it's one that we're currently working on.
A question from Elizabeth, and it's a really important question because a lot of the work around cities and communities is actually executed and developed at a municipal level. So how can municipal employees effectively implement age-friendly policies? And I want you to just touch on, you know, not that you can because you're WHO, but you know, politics sometimes gets in the way of policies. So perhaps you can touch on that as well.
Yeah. I mean, I think people in municipalities and municipal leaders have both incredible responsibilities and incredible opportunities to create positive change, you know, for all people within those communities, including older adults. So I think to be able to enable them and empower them to be able to make the best of these opportunities, it's really important for them to understand what's important to older adults, to be able to understand that engaging with older adults is absolutely essential to understand the context and what they can do, to understand that there are resources, there are other people in other cities and communities, there's the WHO, there's IFA, there's a range of affiliates that are poised, ready to be able to support municipal leaders in their desire to become more age-friendly, and if really they commit to making that a priority. And so that there are a range of resources, I think, both from other cities and communities on how you can assess and plan, but also fabulous examples of concrete practices that cities and communities around the world have been implementing, which show great promise. So I think that municipal leaders in many ways have little excuse for not sort of taking it on, because there are an incredible range of supporting resources to enable them to do so.
Okay. Now we've got another question. I'm sorry, but we're going to keep you very busy, Alana.
I can't even answer politics get in the way.
Well, we have a question from NASA. And the question is, how do you identify elderly people who need supportive housing? How does that fit into an age-friendly policy approach?
The most important one, no, not the most, but one of the key aspects of creating age-friendly cities and communities is really that role of assessing and understanding, the context in which you're working and what are the priorities, and trying to make sure that in that sort of general assessment of understanding what the needs are, that you reach the unreached. So, older adults who may not come to a consultation, because of limited capacity, because they haven't heard about it, because the transportation links don't work. So trying to really make sure that in the process of understanding what are the needs and prioritizing those needs, that the voices of or representative voices of older adults, including those that may not necessarily turn up to general consultation, are heard. And I think that would also provides the opportunity to be able to learn, or you can do a specific sort of assessment on identifying specific needs within supported housing or housing options. You know, but whether it be specifically on housing or more generally on the environments in which older adults live, I think the first thing is obviously doing a scan, talking to older adults and understanding what are the challenges that they find with the existing options, getting their suggestions about what might improve or make a difference in terms of their lives around those options, and then drawing on the incredible evidence that does still exists on the range of options that you can have in terms of supported housing, to be able to determine what might be the best option for that particular municipality. Did that help, Nessa?
I was mute. So the next question, Alana, is about, you mentioned that more older people will be living in low and middle income countries.
Yeah.
It's likely that these older persons will be living in informal settlements. How can we start to understand the concept of healthy ageing and the age-friendly framework within a context of informality? It's a great question.
It's a great question. Yeah. I mean, there is work being done in this area. We ran some research 2015-2016, looking at what were the needs of older adults in this case we were looking at 3 countries in Africa, and just seeing how much their needs differ from the sort of priorities that we outline within the global guide on age-friendly cities and communities. You know, even within those informal settings, yeah, many of those informal settlements, people live for extended periods of time. So the principles of the age-friendly approach is still very relevant. Going in and understanding within that context and with the people that live there, what are their particular needs, what's working and what's not, and where their priorities are, should be the basis, whether it's in an informal settlement or a more formal residential setting. And we saw, for example, and I think we included this example in the World Report on Aging and Health, that, for example, in the slums of Delhi, you know, when people went in and started talking to older adults in the slums, the most important need that they identified was security. They were fearful, really, of being able to go out into the streets and move around freely. And so there, the local police, who were responsible for the slum divisions, identified, you know, a contact number which older adults could call, and provided, because everybody had mobile phones, even if they didn't have fixed landlines, but they did have mobile services, you know, to be able to register and make those personal connections between police and older adults within those slum communities. You know, so that's an example of identifying a priority which is relevant to that particular community, and the need to ensure that we're actually focusing our efforts on what is most important to, not what we think is most important, but what is most important to those communities, is key, irrespective of where we might be providing support.
Okay, from Carol. Public health units are often active agents for change for population health. Has the WHO linked with public health units for an inventory of their initiatives and strategic action plans. And I guess you can make that comment about, you know, the politics in this as well. So could you comment on that?
Karen, it's actually a really interesting idea, and it's not something that we've done. Obviously, we've been promoting for quite some time sort of age-friendly primary health care, and, you know, we're going to be looking at, you know, the implications of universal health care and age-friendly healthcare services more broadly. But I think it would be I think it's a really interesting idea to sort of go back to those units and see what they actually are doing, in the same way that we're going to cities and communities in other areas and looking at, you know, what they're doing, you know, what are some of their practices that they're most proud of. So it's not something that we've specifically done with public health units, but it's certainly something that could be done, and it's a very interesting idea. Thank you.
Okay, we have someone calling in from the Southern Hemisphere. So this is in regard to, yes, so up very late, or very early in the morning. Immediate past President and Director General of Health Promotion Administration for the Ministry of Health and Welfare in Taiwan. All of the 22 cities and counties in Taiwan are implementing an age-friendly city initiative. But they've found that rural communities are ageing more rapidly than communities in the cities. And elderly living in rural areas are facing underdeveloped infrastructure, difficulty in public transport, inadequate human resources. So the question is, shouldn't age-friendly communities initiative be more urgent than an age-friendly cities initiative? And I think that it's a really important question.
Yeah, it's a really interesting and I think a very valid question. I don't think that we can do one and not the other. You know, I really think that there is a need to look at, you know, if we're looking, yes, there is gentrification and there are real challenges around small communities and rural environments, and we need to do much better at looking at how to support those and identifying innovations which are working elsewhere that may be useful for rural communities. But given the also trend towards urbanisation and the numbers of older adults living in urban environments, you know, it is also essential that we actually really invest in what's happening within cities broadly, and cities and mega cities around the world. So I think that what we need to do is be doing both, and not playing one off against the other. I really think that there's great opportunities for enhancing both rural and urban environments to become much more age-friendly.
Okay. And Alana, we've got, you know, a lot of other questions coming in. So could I just reassure all those that are sending in a question that those that aren't answered on the call, on the webinar, will actually be sent to Alana, if that's okay, Alana, because I think that they really provide some rich information.
That would be great.
From Richard, Alana, could you comment on the importance of planning and developing compact, complete, mixed-use community support to support ageing in place?
Richard, it's really important. You know, I think that there is strong evidence around urban development and the value of mixed use environments to ensure that very diverse people can live within those communities and have access to the services that they need. Probably, I think the evidence on, there's a bit in the World Report if you have a look in Chapter 6, but also, you know, I think this is probably an area for more research and development, also in terms of the nature of those mixed use and the impact that that has, which will be differential depending on those groups. I think that's something that we don't really know enough about, so certainly an area for more work.
Okay, so this question, and there's a couple of questions about, you know, sharing information between nations and developing communication platforms for seniors. This question is from Jung. One of the most beneficial parts of having an international network is sharing. How has the WHO worked to ease and support such sharing of information between the many different languages and, more crucially, cultures? It's one of those very difficult situations that I think we all deal with.
Yeah. You know, I think that this is an area that, in terms of the overall development of the global network, we need to invest much more in. You know, it's a real challenge, and you can imagine in terms of the costs of having information available. We have 6 official languages, you know, and trying to do that. I think at the moment the network is strongly Anglophone in that sense, and we've really tried to expand, and you'll see there's a lot more information now in French and Spanish than there was in the past. We're also trying to create opportunities for linking between, and that was a bit I mentioned about the sort of mentor program and linking between cities and communities. For example, there was a really interesting request the other day for older adults in Australia who wanted to link, so a group of older adults who are a committee in one city and in Australia, who wanted to link actually with another group of older adults in another city and community in Australia or more broadly, to be able to learn about how they approached, you know, advocating in terms of local politicians and just generally sharing and exchanging of experience. So I think that there's a real opportunity to be able to share between, you know, the diverse stakeholders that are involved in creating age-friendly environments, you know, directly, but also capitalize and share their learning and experience in other ways, whether that be through conferences, you know, through webinars or through other opportunities as well. But I think it's really an area, you know, and if you've got some great ideas, you know, send them in. It really is a challenge, ensuring that people can get access to information in the language to which they feel comfortable.
You know, we have a great question from Jan, and I think she's talking from Yarmouth on Cape Cod, about expanding the mission to be friendly for all ages, emphasising intergenerational programming. Have you seen this enlarged sense of direction elsewhere? Because that's what their age-friendly Yarmouth is doing.
I mean, I think that I think that the age-friendly approach, and certainly the approach to healthy aging and WHO's approach and principles for the Global Strategy and Action Plan, are very much a life course approach. So I think that that approach is key to all of the work that we do, and at the same point, not negating and neglecting the needs of older adults, and making sure that in the work that we do we can address those effectively. So I think really, you know, and I think, to be honest, what I've seen in cities and communities around the world is that they tend to use what works for them at the time. And maybe this is a little bit in terms of the question you posed previously, Jane, on dealing with the politics. And what I've seen is some cities and communities will take an approach to all ages, if that politically resonates, whereas other cities and communities might focus on older adults because that really is the priority. So I think that the approach itself is very flexible in its ability to be able to respond to what are both the needs within the community but also the political agendas, which in reality are going to drive whether the approach gets traction or not.
And that really moves us on to a question about the age-friendly planning framework. And I've been asked on many occasions about these 8 domains. And the question from Sarah is, are there any plans to review and update? Because, for their community, the community that Sarah's representing, the plan was organised around these domains. But I know, though, that in some locations of the world, they've taken some of the domains, but they've also reached out to understand what other domains would fit their population. Could you comment on that?
Yeah. I think that there is, Jane, as you're saying, there's a lot of thinking around this, and I think that we should, I think that it is the opportunity now, I think, now 10 years along from the time that the guide was developed, with this sort of new political agenda within WHO and the prioritisation around age-friendly environment, I think it is an important time to think and to harness the experience and see how to move this forward. I think what we're seeing, and I think your comment reflected very well, Jane, was that people are working in domains which make most sense to what the needs are, and that they interpret them and frame them differently depending on their context, and that's what they should be doing. Yeah, I think one of the things that we do want to do is marry, I think, very well the work that, and build on the work of the age-friendly cities and community, or cities approach with its 8 domains, and the work from the World Report on Ageing and Health around healthy ageing, because they're really complementary. But the approach within the World Report on Ageing and Health is much more strongly focused on what all sectors can do together to ensure that the outcomes for older adults. So less about the means and more about the outcome. And I think that we need to push towards making sure that we are focusing on results within age-friendly cities and communities. I know, I've got incredible political commitment for this approach now, but countries are going to be asking very soon for, cost-effectiveness information about why they should be investing. What difference does it make, and why should they be investing in an age-friendly approach versus something else? And there we really need to be able to show that the work that we do in cities and communities delivers outcomes that are important, that are the most important for older adults, and that enable them to experience well-being. So yes, I think that as it is, the World Report on Ageing and Health already in many ways rethinks the work that was done in the guide, and I think takes that at another level. There's also really interesting work that's been done by the European Office of WHO, and I'm hoping that will come out very soon, where they've also tried to draw on experience and have reflected based on that experience in terms of the approach and in terms of the domain. So, we hope as part of this webinar series that when those reports are available, we can get them out and share them with you, and have the opportunity also for discussion.
Lana, Karen asks a question about age-friendly universities, and I certainly know a couple of universities that are working in this domain. Is that something that fits within the age-friendly environment sort of concept? Could you comment on that?
Yeah, do you want to talk, Jane? Because you had more experience directly in age-friendly universities, so I'm going to hand this one back to you.
Look, Karen, I do know that there's 2 or 3 universities that are really building some of the curriculum, around the concept of age-friendly cities and communities, and they're in age-friendly environment. I think it's very new at this moment, and certainly if you'd like to drop me a note, I can very happily make the connection to those. And, in saying that, IFA's goal is to be a point of connection of experts and expertise to influence and help shape policy. And as we come to the end of this, our first webinar, and I thank all of those that registered, but also all of those that are on the call right now, I want to also very much thank Alana for, you know, fronting up to be our first guest speaker. And we're very proud and honoured to have a relationship with the WHO and do this in partnership. So would you like to just make some of your closing remarks, and then I'll sign off?
You know, I mean, I think it's a great opportunity for us to be able, or at least for me to be able to talk to you a little bit about, you know, what's happening at WHO in this area. I wish we had more time. I think that this is a great mechanism, at least for starting to exchange and share, and I'm really grateful to IFA for doing that. You know, I think that the conversation, you know, the questions are fascinating. I think, I think that we need to continue these conversations and we need to learn from each other. But, you know, I also think that you know, through these processes, you know, I would like to think that you're going to be involved also in the strategic development and the direction that the network takes, because obviously the network is there to serve you. So, you know, I just want to thank you for taking the time, you know, across the world to be present and to both listen and to get involved and ask questions and comment. So thank you very much to all of you on the line, and very much to IFA for all the support in organising the webinar.
Okay, look, thank you very much, Alana. And to wrap up, could I just tell everybody on the line and those that registered that this whole session has been recorded, and so that's going to be publicly available on the IFA website, and also to be sent out through our communications and loaded up hopefully on the Age Friendly Environment World website. And that will certainly be happening soon. I'm also delighted to let you know that in April, our second webinar will be on indicators, which is, you know, how do we measure the impact of age-friendly cities, communities, environments. And we're very proud to have Megumi Kano from Japan, and she'll be making the presentation based on the work of WHO Kobe Centre. IFA will be sending out a very brief evaluation form, so your ideas, good, bad and indifferent, are welcome. And we always welcome the opportunity to connect people to people and people to information. And finally, I want to thank the person that led the development of this webinar series, Jessica Rockman-Fowler, IFA lead in this particular area, but also staff, Savannah, Kate and Virginia. So thank you once again, Alana, and the partnership with the WHO and all those people that are on the call. We can be accessed through our website, but also the website, our website is IFA, I can't even remember it now, ifa-fiv.org. And you see on the screen the WHO website to engage with the age-friendly environment. Now I'm getting all tongue-tied, age-friendly world website. So thank you all once again, and thanks Alana for being first up. An outstanding first webinar. Thank you.
Thanks, Jane. Bye, everybody.